The number of COVID-19 cases identified in South Africa stands at almost 1,459,000. More than 2,600 new cases have been identified since the last report. So the Health Department says 547 more people have died of COVID-19 in the last reporting period. 68 deaths were recorded in the Eastern Cape, 30 in the Free State and 91 in Gauteng. A further 143 people died in KwaZulu-Natal, 134 in Limpopo and 9 in Mpumalanga. The Northern Cape has recorded 3 deaths and the Western Cape 69. So this brings the total deaths to 44,946. Our recoveries now stand at 1,318,504. That's representing a recovery rate of 90%. In related news, the Department of Health has launched the electronic vaccine data system self-registration portal, so the system can capture the relevant metrics of all South Africans that will be vaccinated, also ensure that vaccinees are contactable and alerted to optimize adherence to the regimen, and complete the certification process such that vaccine certificates are easy to obtain for vaccinees and authorities that may require this certification. Let's chat a bit more about this. Dr. Lesley Bramford, the Acting Director of Child, Youth and School Health at the Department of Health, joins me now. A very good evening to you, Doc. Thanks indeed for your time. So talk us through how this system will now work.
So good evening, and good evening to the viewers. So obviously the vaccine rollout is a very exciting but a very large project, and one of the key tools that we're going to be using to manage this process is what we're calling the EVDS, and that is the electronic vaccine data system. Now, the system is going to have a number of functions. It's going to perform a number of tasks. Yeah. And essentially, anyone who is going to be vaccinated is going to need to be registered on the system. Yeah. I'll come back to the registration a little bit later. When someone is vaccinated, this will then be recorded on the system. So that we have a record. The system will then assist with ensuring that people receive their second dose if they are on a 2-dose vaccine. Yeah. And will also then people who have received the vaccine will be able to access proof of registration. So this is a tool that will assist people to get vaccinated, and will also allow us to plan and monitor and respond, because we will have a good overview of the situation with regards to vaccination in the country.
Doc, I want to talk a bit about that. I mean, given that healthcare workers will be the first in line in phase 1, is the system able to detect whether that person is indeed a healthcare worker when they register? And talk to us about the systems of checks and balances that have been put in place.
So the system will include a beneficiary register. So that is a register of health workers in South Africa. And we've put a lot of effort into making sure that we compile that registry. So there will be checks and balances. As you indicated, phase 1, we are targeting health workers. Yeah. We have a very broad definition of health workers. So this includes our health professionals, those working in our public hospitals, in our private hospitals, in our facilities, in our GP practices and pharmacies. Also health workers who work at community level, such as our community health workers, and other groups such as our traditional healers and funeral parlor workers. Yeah. When we kick off, our very first focus will be on our health workers working in our facilities, because we know that those people are at highest risk of exposure. And there are systems of checks and balances so that we can be sure that we are vaccinating the correct people. People will be, in many instances, requested to self-register before they go for vaccination.
Yeah.
But even when they go for vaccination, they may be required to provide proof that they are eligible to be vaccinated.
Yeah. Doc, we're running out of time. With a system like this, I guess, many would ask themselves whether those in the rural setting, those community health care workers in the rural setting, this system would then be able to detect the nearest point where they'll be able to be vaccinated. We often have a conversation about healthcare workers in the rural space who would be far away, from some of these facilities. Is the system able to do that, to send anyone to the nearest facility, in fact?
Okay, so I think it must be made very clear.
Yeah.
I indicated that everyone who is vaccinated will need to be registered on the system.
Yes.
And we are encouraging people to be registered before they present for vaccination. However, if people are eligible and they present to a vaccination site, they will be assisted to register if they have not been able to register before going to be vaccinated. We are very aware that many South Africans do not have access to a cell phone or the data.
Yeah.
So this is a system that is trying to make things easier for the individuals who need to be vaccinated, to make things easier during the vaccination process, so that it can go more smoothly, more quickly. But we are very aware that it should not and will not be used as a way of making access difficult for people who may not have access to a cell phone and to data. Yeah.
I'm afraid, Doc, that's all we have time for this evening. Thanks indeed. Dr. Lesley Bramford, the Acting Director, Child, Youth and School Health at the Department of Health. Thanks for bringing us up to speed with that process.